Hi, Sandy. People are just starting to come in.
Okay, great. I'm jumping off one, finishing up one session, jumping on another.
So I was doing that too. It's never a dull moment, is it? Hi, Duana. How are you?
I'm doing well. How are you?
I am great. We're ready to get the show started. We're just.
Yes, I said, I still have the NBOTC background. Aha. Okay, I'm trying to figure out what I'm doing here.
That's all right. You got time. You got time. We're just still.
Okay.
People are just starting to log on, really.
I'm just wondering what, yeah, so I don't have a background. That's what I get, you know, when I have 13 different computers and I don't know. Yeah.
Wow, that's a lot.
I may have to leave this one on. Yeah, I have so many. How many people or what's going on?
We had almost 200 register, and we normally have roughly about 60% of people who register will show up. So, I mean, it kind of varies, but that's just a general rule of thumb.
Yeah. I wonder. Oh, yeah. When you pop it to the north horizon, you're the ones having all the fun. Okay, I'm going to mute myself for just a minute now that I know.
Feel free, because we've got like an intro for several minutes first. So you guys, the panelists, have got time. Okay,
all right, great. Yay.
No worries, just relax into it. It's going to be great.
All right. I'm so sorry I didn't get a chance to join one of these earlier so I could have an idea, but you gave me a great email and everything.
Good. Yes.
Okay. All right.
This happened for real, for real. Why you walking home from school? Shouldn't went my way. Females in the hallway. I show keep licking on the hallway. Wait. I was so scared. I ain't had no beef from them guys. She did when I ran. And I hid it behind a big man. My pocket was for rent. Two shots and I shot it. Shot didn't go. Get up. Why you walking home from school? She's carrying my he's selfish. Together and feel alright. And I will feel alright. Together and feel alright. Who has hurt on me? Save the soul, believe ancestral standard. There ain't no the Father of creation. Yeah, yeah. And I will be alright. Together, feel alright. I will be
Good evening, everyone. Thank you so much for being here at the final session of Ignite 4. So this is session 3, a follow-up to our 2 previous sessions. And shout out to everyone who is both from within the US, and we have some international folks here. Really glad to see you. Thank you so much. I know we still have some people joining, and that is fine. So we have an exciting closing to Ignite 4, and I'm going to tell you about that. And we also have some super exciting announcements about what is next, how we are going to keep the momentum going after these Ignite series that we've had over the past 9 months or so. So let me tell you a little bit about tonight's session. We are looking at the topic of promoting inclusion of people with disabilities in the OT profession. Okay, hold on. I'm having a little technical difficulty. 1 second. Let me share a different screen. Okay. I don't know why we got that going. Okay. Now let's try. Is that better, everybody? Anybody?
Good, Stephanie, we're on.
Okay, thank you, Lexi. Thank you. Okay, so this is our topic for tonight, this evening. We are talking about, let's see, hold on 1 second. I do want to caption. Okay. So we are talking about what we're doing is closing up this call to action for disability inclusion within the OT profession. You know, I think there have been other sessions kind of here and there that some other groups have done along the way, even, of course, outside of the OT groups. And a lot of times we talk about inclusion and equity and justice that is in general terms. But we thought we would focus things in this session within the OT profession. It's something that maybe hasn't been done in this exact way before. So my name is Stephanie Lancaster. I'm the vice chair of COTAD, and I've been the facilitator and coordinator for this 4th Ignite series. I'm also the program director and an assistant professor in the Occupational Therapy Department at the University of Tennessee Health Science Center in Memphis, Tennessee. So that's where I am tonight. Hello to anyone else from Memphis or Tennessee that is joining us tonight, and everyone else. I want to tell you just a little bit about what was the catalyst for this Ignite session, or the whole series, really. This originated as the brainchild of the chair of COTAD and one of the founding members, Dr. Arame Anvarazade, who is on the call with us tonight. At the time, she was the COTAD vice chair, and it was in the early days of the civil unrest, which came to a head in our country after the killing of George Floyd as he was being arrested by the Minneapolis police. As a grassroots, action-oriented organization, COTAD swiftly responded to that injustice and all of those that it came before it by developing and organizing the Ignite series as a platform to elevate the voices and share the knowledge and experiences of Black and Indigenous people of color or BIPOC in the OT profession, as well as those with disabilities, people in the field of OT who identify as LGBTQIA+, and other underrepresented members of the OT community. Through the Ignite series events that we've had since that time, we're expanding our efforts to provide support, resources, and safe spaces where people from all backgrounds can learn and be enriched by our colleagues whose experiences often go unheard. The overall goal of the series of Ignite sessions is to ignite people in the OT profession to take action to promote diversity, equity, inclusion, and justice within the OT community. So the first Ignite session that Dr. Anvarazadeh really came up with started last June, and that session or series addressed racism and its impact on occupation and occupational therapy. Shortly after that, we launched Ignite Series 2, which was Action and Inclusion in Occupational Therapy Education. Then last fall, Ignite 3 addressed LGBTQIA+ inclusion in occupational therapy, and that brought us to this series, which has run in the first few months of 2021, the Call to Action for Disability Inclusion in OT. So here we are at the third session. We've kind of looked at the barriers and challenges of people with disabilities in the OT profession, and as well as the recruitment, retention, and support of OT students, which was our last session. And we had several people to speak on the panel about the experiences, challenges, and things that helped in the experiences of OT students with disabilities. And we are now in session 3. So I would be remiss if I did not thank the COTAD supporters and donors, which are increasing almost by the day these days. And I want to highlight a quote by one of the founding members and the past chair of COTAD, Dr. Catherine Hoyt. "We must always do our best to build a table that has a spot open for others' experiences and voices that we have not yet heard." That's what we're here to do tonight, both to hear and learn from the perspectives and experiences and expertise of our panelists and others who are here in attendance, and to culminate this session and this series and all the Ignite series with very specific action steps that each of us are going to take going forward. As a community agreement, we need to use I statements. We need to recognize that everyone has their own truth, allow space for others to express and finish their thoughts, to talk about the problem, not the person, and of course, to respect everyone's experience and voice. Here's our agenda for tonight. We will start the panelist presentations shortly. And following that, we will go into small breakout sessions. Then we'll come back and have a large group debriefing, and then we will have a closing, which again will include some announcements about what's next. How can we keep the momentum going? So it's my honor and privilege to introduce to you now the chair of COTAD, my very good friend and colleague, Dr. Arame Anvarazadeh.
Hi, everyone. Thank you, Dr. Lancaster, for such a wonderful introduction and just a nice history of Ignite, which now we have kind of like this historical archive, which is awesome. Welcome, everyone. I'm so happy to see everyone here and to have this discussion. I've been asked to speak a little bit about COTAD's history and our mission and vision. Next slide, please. So COTAD started in 2014, and our mission has been always to empower occupational therapy leaders to engage in practices that increase diversity, equity, and inclusion for a more transformative occupational therapy profession. I would like to also add justice in there. And our vision is to be a future in which occupational therapy is accessible, inclusive, and effective for all. Very appropriate for this evening's discussion. And as I mentioned, in 2014, we were a group of emerging leaders. Several of you may remember the AOTA Emerging Leaders Program. And we really wanted to highlight areas in the Centennial Vision. And at the time, you know, the evidence-based, the science-driven, okay, cool, we're there. But the piece that we really questioned was being a diverse workforce that met society's occupational needs. And we really challenged that. And we did a presentation at the next conference and talked about the importance of having a diverse student body to increase diverse representation in the profession to ultimately decrease health disparities. And that's what we've been about at the end of the day, is how do we decrease health disparities and bridge those gaps? And I think people might think we might be a full-time COTAD in an office located in the same city, but we have been a group of leaders, and several of you are board members and executive board members on this call today. Thank you all for being here. That we've been building over Zoom since 2014 across all different states in this country, and really, really rooted in this work. We're very excited for the increased popularity of COTAD since June, but almost been doing this work for a decade now. And we started to make sure that our organization had structure and pillars. And one of our programs is called COTAD Ed. And COTAD Ed is really providing the support and space for academicians and faculty. And, you know, this idea of decolonizing the curriculum and increasing faculty representation is really hot topic right now, but we've been very focused on this for years now, looking at accreditation and requirements for DEI and justice in our profession. Then we also have the COTAD Mentorship Program, which was formerly known as the Minority Mentorship Program, where we believe that mentorship is key and representation matters. So that COTAD Mentorship Program has grown tremendously, led by wonderful leaders, Dr. Megan Lambert and and Helen Valencia. And then we have the COTAD chapters, which is our safe space for our students. We have started a few years ago with only 2 chapters, and now we are 3 years later have over 90 chapters across this country. These students are empowered, they're mobilizing, they're organizing, and they are creating change. So shout out to any COTAD chapters who are on here this evening. And our latest pillar is COTAD Community, and you'll be hearing a little bit more about the COTAD Community Challenge that we have now. And it is about how do we support diversity, equity, inclusion, and justice within our communities. Our 2 newest pillars, which you probably won't even see on our website, is COTAD State. It's how do we increase our visibility at the state levels, at state conferences, and the conversations that just happening one time at AOTA conference, but throughout the year. And then our next newest one is COTAD Impact. Oftentimes we are talking about evidence-based, science-driven, but we do not have diversity-driven data. And so we really want to look at how are these programs that are action-oriented, that are creating change, making an impact in our profession. So that's just a little highlight of our programs, our pillars. We have so much more, but I want to make sure that we get started and we stay on time. Please check out our website if you want to know any further information. Dr. Lancaster, thank you so much. Welcome everyone. You're here for a treat. I pass it back to you.
Thank you so much. I appreciate it. We are, there we go, about to go into our panelists, but before then, I want to give you a little bit of perspective that occurred in the planning of this particular Ignite series. I want to address something that's really important for us to acknowledge and consider. Because Ignite, as I said, when I was talking about the history of this series, because it was created to elevate the voices of those in the BIPOC community, we did attempt in planning for this event and in the whole series to find panelists who identify as being in that BIPOC community. But with only 16% of OT practitioners and now 26% of OT students, according to the most recent AOTA workforce survey, identifying as being from underrepresented racial or ethnic groups, there's an even more limited number of OT students and practitioners in the BIPOC community who also have a disability. So that intersectionality made it really challenging. And I think that really speaks to why this series is so very important. And the Ignite series and everything we're doing in COTAD to take action in justice, equity, diversity, and inclusion. So I am pleased to introduce our very first panelist this evening, Dr. Barbara Kornblue. And her bio is on this slide for easier viewing. Barbara is an attorney, an occupational therapist, a certified case manager, a certified disability management specialist, and a person with a disability. She's a professor working remotely and a program director of Idaho State University's occupational therapy program and a national disability rights advocate. Dr. Kornblue is a former Robert Wood Johnson Health Policy Fellow in the US Senate, where she worked on disability issues for Senators Harkin and Rockefeller, and a past president of AOTA. She also served as a government relations and health policy consultant to Special Olympics International and the American Association of People with Disabilities. And in this capacity, she created and led the coalition of disability organizations that succeeded in getting disability included in the Affordable Care Act, everywhere the words racial and ethnic appear in that act. As an occupational therapist, she has consulted with employers, developers, local governments, and others on making things accessible under the Americans with Disabilities Act, the ADA. As an attorney, she litigated cases under the ADA involving discrimination in employment, state and local government services, and healthcare services. She is widely published and has presented her work on disability-based health disparities at the intersection of race and ethnicity as a panelist at several congressional briefings. So welcome and thank you so much for being here. I'm going to turn the microphone over to you.
Barbara, I think we're still on mute. Asked to unmute.
Barbara, can you unmute?
I hit the mute button
Woo!
on my
There we
on my thing, so I didn't realize it was on that too. So
Okay,
sorry.
there we go.
Anyway, I mean, I live on Zoom too. I'm not that stupid. I just whatever. Anyway, I have had a very interesting experience as an OT with a disability myself. Working with students from all over the country with disabilities because they find out that I'm an attorney and someone tells them to call me. And just the way I've been treated within the profession. So for example, when I decided to run for president of AOTA, a very prominent occupational therapist who will remain unnamed, who was a white walking woman, who was probably more than 100 pounds overweight and was out of breath if she took 2 steps, called one of my faculty and said, how can Kornblue run for president of AOTA if she uses a scooter at conference? Which I thought was very ironic when, that was presented to me. I thought, at least I can get around. This person has a lot of trouble getting around and is really stupid. The other thing for me is since I've been president, I'm one of the only past presidents that's never been appointed to anything since then. And I kind of wonder, is it because I have a disability? I don't know. But what I have found in dealing with other therapists with disabilities is that as a profession, we tend to treat people with disabilities as patients, not colleagues, no matter how you look at it. We look at people with this, in our profession, we look at colleagues with disabilities as at least a step down. We don't see them as equals. And it's a very, very frustrating experience for me to see that happen. And I see that happen a lot when I get calls from students. And I can tell you some of the stories I can tell you, because one of them, this young man wasn't so young, but he wrote this in a journal article. And he was in Vietnam as a young man, very young man. And he didn't know the hearing loss. And his hearing loss was at mid-range where women speak. So he was having problems with fieldwork because the fieldwork people would tell him something and he didn't hear them. And he finally realized that he had the hearing problem, and he started recording his sessions, his supervisory sessions, which was kind of interesting because I got to hear his faculty talk about me. And why are you going to her? She doesn't know anything about this. You know, she works in pediatrics. Like, I do. I didn't know that. So it was very interesting to see this. And he was just asking if people could write things down for him and if he could have record sessions. And they were like, well, we can't ask your supervisors to record sessions, your supervisory sessions. And it's like, well, if you do that, then my wife can transcribe it, or my wife can tell me what was said in case I didn't catch everything. Oh, we can't do that. You know, why would we do that? And he was, because I can't hear. Well, get a hearing aid. Hearing aid's not going to help me because it's only in mid-range where women speak. So this was such a bizarre scenario. And finally, I had to kind of tell them that you've talked to me. And they knew I was an attorney. And they knew that I did ADA litigation. And so they kind of were nicer to him. And he and I would meet regularly and come up with strategies on what he could do. And that's not an unusual situation because over the years, I've gotten tons of calls from students. And just that, the conversations are faculty, supervisors in the field treating students with disabilities as patients and expect, kind of like, well, how are you going to fix this? Well, I can't fix it, but I have accommodations. And if you will just do this and hand me this, then I won't have a problem. And just this idea that, you're an OT, you should know this. You should know that you have to make accommodations. And sometimes I wonder, how can we change the profession so that we teach students who are going to become faculty how to treat a person with a disability as a person first. Theoretically, that's what we should be doing, but apparently we're not doing that. Now, I can tell you, another story, and I'm trying to give you stories so I'm not giving away anybody's confidential information. So I'm going to sort of change the facts a little bit. This student had a disability, and she had asked for, she didn't ask for accommodation. She didn't need any. But the facility saw that she walked funny, and they had a problem with that. So they asked her why she walked funny, and she told them that she had a very low spinal cord injury. And she had a problem with, she had a P, and she couldn't find her supervisor to have the supervisor watch the client. So she was looking for the supervisor off flirting with some guy, and she wet herself. So she told someone else, I have to go home. I have an emergency. Can you watch my client? So she went home and she took care of everything. And the next day when she got back to the clinic, the faculty were there from her school, and they terminated her fieldwork. And they told her that what she should have done is she should have washed her clothes in the clinic washing machine. And she should have taken the dirty clothes that we use for trying, like the old sweatpants that are in the clinic that we have everybody practice dressing on, that she should have put those on and continued to work for the day. And that's like adding insult to injury. So she went to another facility. They replaced her somewhere else. And the first day that she was there, she said something really brilliant. And they said to her, how do you know that? She made a really good suggestion. How do you know that? She told them what happened. They said, oh, we would never do that to you here. So she gets an email that night that says, don't come in tomorrow, go to your school. She goes to the school. The school says to her, they terminated your fieldwork. One day. And that was it. She was out of OT school. And, when you think about it, she would have been a great OT because she had empathy. She understood. She went through rehab. She knows what it is. but we kicked her out. And, you know, why did we do that? It just made no sense. So I think one of the problems we have is we have to figure out a way to teach faculty how to teach students how to have empathy, how to treat people like equals, that everybody's the same, whether you have one arm or two arms, you're still a human being and you're someone who should be treated as an equal. And I think, you know, the DEI movement is seeing obviously a lot of this with racial and ethnic groups, and the concept of intersectionality, you know, getting this all together. And I can tell you that when we were working on the Affordable Care Act with the coalition, the reason I formed that coalition was because I had gone to a coalition that was a racial and ethnic groups, and I showed up with the LGBTQ groups, and they wouldn't put disability in their sign-on letters. And I kept, you know, saying, why don't you do this? Why don't you do this? And we would have meetings. And finally, these two guys came over to me and they were in my face, and I don't remember what they were. I just remember they were tall and big. And they said, what are you doing here? This is for racial and ethnic groups. And I said, you got a grandmother? I said, yeah. I said, well, your grandmother has a greater chance of becoming diabetic than my grandmother. And if your grandmother becomes diabetic, she has a greater chance of having an amputation earlier and more and at a higher level than my grandmother. And once she does that, she's going to be a wheelchair user. And if she needs to have a mammogram, she may never get one because the mammography facility is not accessible. Don't you care about her? And he said, well, we can care about her in the next bill. So that's when I said I took my bat and glove and I started my own coalition. And the best thing was that after I succeeded in getting all the national and local groups together and getting it in the bill, what did they do? They opened the tent and they let me in. And now we have the HEA coalition, the Health Equity and Accountability Act, and it works on intersectionality. I'm on all the panels when we have panels. I've spoken with Micah Morial from the NAACP, or not NAACP, from one of the African American groups that was just like absolutely. I almost couldn't talk because I was on a panel with this guy who's, you know, I've been looking up to and is famous. So, you know, it's just when you look at this and you think about intersectionality, we have to look at these groups together because nobody's just one thing. And when we're looking at students and recruiting students and looking at our colleagues, we have to accept colleagues as with disabilities as, you know, colleagues. And I can tell you that I have had experiences. I went for a job interview once in DC, and it was with the National Council on Aging. And I had I was perfect for this job. And I sent it a resume and they asked, I always say academic CV available upon request. He asked for my academic CV. I sent it to him. And at the end of the interview, I thought it was going really well. And he said, you know, I've placed a lot of people over there and they're constantly moving. They never sit down. And I thought to myself, you know, this is over. And I said to him, I got up and I said, you asked for my CV. It's 58 pages long. When you have a 58-page CV, you never sit down either. And I walked out. And since then, I've told National Council on Aging because I've been on some of their advisory boards and committees. But, you know, the point is we have to look at people first and understand that, you know, we're OTs. We figure out how to do things for other people. If you're an OT with a disability, you figure out how to do things for you. And if you can't do them, you know what your limitations are and what you need accommodations for. And, you know, so if I can't do transfers, you can accommodate that. But, you know, the problem is making assumptions. And when we get students, we had a student who had a visual impairment and they didn't want to take her because she had a visual impairment. I said, but we don't even know what that means. She's obviously not blind because we see her walking around and she doesn't have a cane. She doesn't have a dog, you know, so she's obviously able to get around, but there may be things that she needs some help with or assistance. So give her a chance. If she's going to be an OT, she has to figure out accommodations for other people. We'll figure out accommodations for her with her and we'll figure out what they are. And, you know, just what's just so frustrating to me is the attitude of a lot of faculty who are not willing to do things differently, who are very structured and want things to be the same for everyone, and don't understand that what do? We adapt the world to people. We have to adapt the world to students and future OTs. And we have to remember that that's what we do. We use our occupational therapy brain to look at the world and figure out how we can make matches between what people can do and what people need to do and what they want to be able to do. And if we think of it that way, it just shouldn't be a problem. But, you know, a big part of the problem is that attitude thing, and assuming that, you know, if you're a professor, if you have a PhD or whatever D got after your name, and you have done a lot of research, it doesn't mean that you're good at this. You have to be open-minded, and we have to be able to look at disability and intersectionality as being part of the DEI world, not a separate entity, but part of. And the idea that, you know, you can be African American, you can have a disability, you can speak another language, you know, you can have all of the DEI things or multiples in one person. And that's what faculty needs to be trained in that. And I don't, you know, I don't see it. When I hear these horrible stories that students call me and tell me, I just don't see it. And it's a shame and it's sad, because we're the ones that are supposed to have the expertise in helping other people make these kinds of accommodations for their workers, for their employees, for whatever. And if we're not making them ourselves, then are we failing as a profession? What do we need to do differently to train people? How do we need to train students in this? And it's almost like when you look at the students we're getting today, a lot of the students we're getting today grew up with kids with disabilities in their classes. You know, that's how the world was after the special ed law went into effect. Before that, that wasn't the case. So I don't know if it's the older therapists, the older faculty, I don't know. But somehow we have to stress this theme within our profession that people with disabilities are not just the people that we therapeutize, they're us. And we have to treat them with the same respect we want to treat any other member of our profession. And I guess that's kind of enough for now. Anybody's questions?
Any questions for Barbara at this point? Or comments? I'm guessing everybody's still kind of processing that. I know I am. Definitely a lot to think about, and we have a long way to go with that for sure, but we've got to push forward with that. I agree. All right. So on to our next panelist. I am very honored to introduce Dr. Duana Russell, who is a Wash U graduate, as I am. And we have her bio here in a written slide. Dr. Russell Thomas is a clinical specialist at the Wash U program in occupational therapy. In her role, she provides leadership, community outreach, clinical service, program development, DEI consultation, and classroom instruction. She also serves as the coordinator of the Regional Arthritis Center, a nonprofit committed to the dissemination of chronic disease self-management education in Missouri. Duana has practiced for 20 years in the field of occupational therapy and has special interest in chronic disease management, health disparity, community and population health, and trauma and toxic stress. She currently serves as the president of the National Black Occupational Therapy Caucus. Duana earned her Bachelor's of Science in Psychology from Washington University and both the Master's and Post-Professional Doctorate from the Program of Occupational Therapy at the Washington University School of Medicine. This year, she will complete an additional Master's of Arts in Professional Studies from Eden Theological Seminary. So welcome, Duana. Thank you so much for being here.
And thank you for the invitation. Thank you for the invitation. It was, I was humbled and I was blown away when I was asked to join this evening, because I am a person that I think fit well coming behind the last speaker, and that intersectionality is a huge part of who I am. And because so many of the issues that I have as health conditions are hidden, that many people are probably looking and saying, what is she doing here? That's usually the question I get from everybody, from OT professionals, from doctors. Just name somebody. If you don't really know me and you haven't seen me in action, then there are times where you would have no idea of historically just how much of medical joy, but also a medical mess that I am. So it's ironic that I work with the Regional Arthritis Center that helps to disseminate self-management education within the region of St. Louis, because I actually have arthritis to the point where I've already had a hip replacement. I have another one that needs to happen. Stenosis that caused so much trouble a few years ago that I thought I was going to have to actually leave the workforce. Almost every year I get another diagnosis. And even now at the end of December, I have 2 new ones that I'm currently dealing with. I'm an OT. You would think that I would be able to process this a little bit better than I am, but it's hard. It's hard because of culturally how we have constructed this idea of disability. So when did I get to the point where I actually said, hey, you have certain privileges, but you have chronic conditions that literally affect whether or not you can get up out of the bed sometimes in the morning. Well, it wasn't when I couldn't, when I couldn't get up steps and when I had to crawl. It wasn't when I was having trouble getting from the door of, the car to the door of the building, even though it wasn't that distant. It wasn't a lot of things. As a matter of fact, when I accepted being president of the National Black OT Caucus, I did everything possible to be able to walk without a device and to be able to walk in such a way that I would look like a leader. Now, mind you, these are our colleagues. And on top of this, these are people, some of them, many I don't know, right? But personally, but there were other people in that space that I trusted. I was terrified to have to walk because I said, well, they trust me as their leader. And I'm a pretty confident person when I need to be. Well, they trust me as their leader because I can't give this certain walk. But that doesn't even speak to why I'm really here. It's the hidden things that really get me. And it's these things that I kind of want to talk about a little bit tonight, because those are the things that become issues also when you're trying to be OTs, when you're trying to encourage other people to be OTs. The executive function issues that come up because of the sleep disorders that you have. The other supports that you need in place because the fatigue levels are off the charts. All of those kind of things that are hidden that people do not see, but that still impact your ability to be a therapist in the ways that people expect us to be, even though we're OTs and this is supposed to be our kind of bailiwick, right? So I will tell you that I think the time that I finally got to the point where I said, I can really lean into this, even at work, was when I was in the airport recently. It was before the hip replacement surgery. And someone said, do you want a wheelchair? And that was the first time that I said yes. And I said yes with confidence. And it wasn't this momentary thing. There was something about that space that let me say that this is a part of who I am and I don't have to be ashamed of it. And when I had that moment, that I have good days and I have bad days, and I have times where it's very noticeable, and I have some times where you would have no idea that the struggle is real in that moment. When I accepted that, then I was able to actually lean more into what do we need to do as OTs? How long did I live like that? Dr. Comblow just said, that I was that person who wasn't, who was treating people and not asking, where are they, where are people with disabilities in the boardroom or around our leadership table? Now, mind you, we have people where I work that are doing wonderful things. It's not that. My thing is that I didn't feel like we were calling out to people. I didn't feel like we were calling out to people. So when we put, for instance, an opportunity for position for OT, where were we putting it? Aren't there spaces that were missing? Just like there were spaces that were missing when people say, well, we need more people of color in the profession and as faculty. Where are you putting this information? Where are you connected? Right? So I started asking myself those same questions, and I started pushing on the places in the OT world that are part of my network, and asking those particular questions. I will tell you that some other things that I thought about. So I do a lot of work in trauma-informed care. And a lot of the principles that work there, that work with me being a Black woman, that intersectionality, in that space, there are many things, many tools that I use that I had to say, hey, I need to ask those same questions when it comes to my identity and when it comes to the identity of others, whether they have hidden or physical disabilities. So things like checking on your people, because the health challenges don't go away. So how do you create a culture? How do you look at your policies to make sure that policies that you put in place for everybody else is going to work with somebody that has their own individual challenges? How do you also think about, especially in this time of COVID, accessibility? And I say that because I realized that in many spaces, we would just automatically set up our Zoom rooms. Zoom is an environment also, right? So captioning, while it's coming up now, and it's more popular to talk about it, that wasn't the original conversation. And it wasn't just because captioning might not have been available, for Zoom and YouTube and that kind of space. We didn't even ask the question a lot of times, right? For meetings, for lots of things. So it's those kind of things that in changing culture, we have to look at it all the way around. What are the things that we do? How do we make them accessible for as many as possible, at least being intentional about what we can do? Thinking about the right fit. So what kind of flexibility are you offering for people? Before COVID, if I had said that, that I need to maybe a little bit more time, while that is available, in my particular position, but that's not available everywhere in our profession. It's still that idea that if you can't move fast enough, if you can't do certain things or get in certain places, or then maybe you don't belong in leadership or have that role within occupational therapy. What are we doing as far as not being afraid to share our experiences, so that when we're recruiting, especially in a particular case where a lot of things that I have are hidden, if I'm afraid for whatever reason to share, because I'm afraid that they'll never call me again because I'm just not the right person, I'm not the go-getter, the leader, then what does that say for the people that we want to recruit and bring into the profession? If they don't see it, if they don't hear it, how do they know that they are welcome? So encouraging people who are in that space and have that opportunity that, as you build your comfort level, to do that, to be mentors. And if you're not mentors, If you don't understand necessarily the experience, are you connected enough so that you can make sure that that student, that faculty member gets where they need to go? They get to MDI, they get to Sandy, Hannah Brink, they get to the right spaces, right? And when it comes to education, I can say definitively, I know we are slow in all of our settings with with using primary sources. So we get these articles sometimes that are written by other people about people, but what about having the person that has the particular identity or the particular disability or health issue speaking for themselves? What does it look like to diversify our pictures and our slides? What does it look like to have the different guest speakers? What does it look like to think about reading and arts and all of these other things that we bring into spaces to teach other people, to do it for the sake of letting people speak for themselves as opposed to just for the sake of treatment, right? So I share all of these things to say that I am one of those people that live in what I call a liminal space. It's in between. There's some days where it's very obvious, oh, something's going on with her. And there's some days that you'll never know. And in that in-between space, keep in mind that even with the establishment of culture, there are opportunities, again, to check on your people. When you know that that's an issue for someone, periodically to check in and to say, hey, just checking in, because there's a lot of things that happen in the silence because we haven't quite reached this level of not being fearful in OT land to celebrate and to open up conversations about our own experiences as OTs and how we invite other people into the profession. So I will stop there, but I thank you again for that opportunity, and you can ask questions now, and if you have them later, I'm happy to answer questions later also.
Thank you so much, Joanna. That was really very powerful and thought-provoking. Any questions or comments from anyone at this point? Oh, yes, Susan.
Hi, sorry, wasn't sure. Oops, I tried to lower my hand and I muted myself. I just wanted to say I was a panelist for the first session, and I know Barbara through the aha moments in Canada, and thank you so much, Duana, for also sharing your story. And one of the things that I was thinking about, what I think was different this time around from because we've heard a lot of stories. One of the things that I've been reflecting on is that when you have a disability and you're an occupational therapist, or at least I'm speaking as somebody who was born with my disability and I have a visible disability, so I don't have the ability to pass, or I can pass. If I try really hard, I can try to make myself more normal and more accepted. But I think what's interesting about what both of you said today that I haven't heard very much is that OT, I think, really drives us, or I'm saying us as people with disabilities, to be as normal as possible. And I think this is something that society also very much reinforces. So I don't know whether it's just OT. I think it's kind of a more social thing. But what happens is that I feel like there's a real fear from my colleagues at times that we might create a bias, or we might create some kind of connection with our clients to accepting disability, or that we might share disabled wisdom. I really like that word as well. And so, but what I'm finding lately, and as we're reflecting on this, is that we as a profession have a real tendency to bias our clients towards normality. And so there seems to be a real threat with some of my colleagues, and they have talked to me about that like if I don't check my disabled wisdom, then I'm going to actually hurt my clients, because the goal is for us to strive to show our clients that normal is what they want. And it's something that I haven't really been able to articulate very well, but I just wanted to say, because I heard that in both of your stories as well. And I think that is what leaves many of us out of the profession, or that's, Duana, as you said, we're not looking for the people who would be necessarily a good fit. And that liminality that you mentioned as well is something I feel as well, that in between. And I'm just tired. I'm tired of having to constantly pretend to be someone I'm not. Like, I would like to be who I am, and to be appreciated for the wisdom that I bring, and how we round out the profession. And so, sorry, I'll stop talking, but I really appreciated that in both of your stories today.
Thank you so much, Susan. And I do want to say thank you to the panelists from our previous Ignite sessions for being here tonight. I love that you're back for this, and thank y'all for the comments, questions, and participation. So we're going to move on. And next on our panel is Sandy Hannebrink, who is here this evening to share about her experience, her expertise, and her perspective. Sandy is an occupational therapist, also the executive director of Touch the Future, Inc. Ms. Hannebrink is an OT who has developed a practice niche in advocacy, assistive technology, accessibility compliance by state and local governments, emergency preparedness, and networking individuals with disabilities and service providers to the necessary resources and funding to achieve individual life goals. She has multiple presentations and publications at the local to international levels, including topics on effectively educating and employing individuals with disabilities, developing self-evaluation and transition plans, architectural accessibility, reasonable accommodations, disability laws, disabled sports, and assistive technology. Ms. Hannebrink is the co-founder and chair of the Network of OT Practitioners with Disabilities and Supporters, NOTPD, and helped to establish the MDI network as part of her fieldwork experience at AOTA in 1995. She continues her roles with NOTPD and the MDI network, and currently serves on the AOTA DEI task force. She also serves on the board of OT Leaders and Legacies Society and on the United Nations G3 ICT Neurodisability Advisory Council. Ms. Hannebrink has received many awards and recognitions for her work and is proud to be a Team USA Paralympian with multiple medals and records in multiple sports. So welcome, Sandy. Thank you for being here.
Thank you, guys. And the next slide, I also put that link in the chat, is for the next aha moment, which is Sunday. So we hope some of you will join us for that as well. I know Tal and Susan will be a part of everything as well. So yeah, I wanted to kind of build on what Barbara and Duana have already shared. With my own experience and the experience of providing support to thousands of students and faculty and employers and professionals with disabilities in the OT profession over the last 26 years, I guess. We see a lot of, we claim in OT that we help people do whatever it is that they want to do in life. And I always add the except be our peer. We talk about therapeutic use of self, but over and over and over, students and professionals with disabilities are told to put that in the drawer, close it, lock that door. Don't use your own therapeutic use of self. Again, we disregard disability identity. We only look at disability with regard to diagnosis and treatment. as the almighty healers to prevent or help someone recover and from their disability to become normal or as normal as possible. We teach for individuals that they must accommodate to the environment, not that the environment and society should accommodate to individuals and all individuals' unique needs. We talk about universal design, but we don't practice it. We think it's okay that because technology hasn't evolved to where it needs to be or should have been with regard to captioning and interpreters and navigation for individuals with cognitive disabilities or people who are blind or people who are mobility disabilities or just even not triggering seizures or contrast or low vision, et cetera, et cetera, et cetera, that it's okay to give that to people later, that they don't deserve the same opportunity to fully participate, that a transcript provided later is good enough, that basically if you're disabled, you're not equal. And so how do we move beyond that, right? So in previous sessions, you guys talked about a lot of the barriers that people face, but the number one barrier we have is attitude. The fact that we're in a profession that is stuck in a medical model of looking at disability as a diagnosis that needs to be fixed or eradicated, and not looking at the person's disability identity. Like Barbara suggested, a lot of faculty think they deserve a right to know what a student's disability is, and they take their educator's hat off and decide that they're now all of a sudden a student or colleague is their patient, that they think they know better. I don't know how many times I've had OTs and OTs that I would have thought would have known better even come up to me at conferences and events and try to tell me how I should do something, you know, having been disabled for over 30 years, or that the way I grip something, there's a better way or something. And I just look at them like, really? You know, or why don't I use, you know, this piece of equipment or that piece of equipment because you don't look as disabled. I'm like, I'm a quadriplegic. It ain't going anywhere, you know. And if the facility and most of our conferences that are done in the world of OT, whether it's local, state, national, or international, are not accessible. They're not physically accessible. They're not designed with that in mind. At best, they look at meeting minimum requirements and then they fall short of that. They put the blame off on the facility instead of making sure that they're taking the steps to ensure inclusion. And so at times I'll even, because I have contacts, get a power chair delivered to use because I know my manual chair with power assist is I'm going to be exhausted, right? Or I use my manual chair with power assist because I can't get on transportation because I have to ride the short bus and use a separate system to reserve that. And I have to travel alone because my peers and colleagues can't travel with me because only the disabled can go on the short bus. That's real in our world still today. COVID has amplified things. You know, we're working with, if any of you are friends with me on Facebook, you'll see me posting, I need fieldwork sites for people and helping people find placement because programs are leaving students with disabilities to last. Students with disabilities are having to graduate semesters and years later than other students because their faculty are not, and their programs are not placing them in the same manner as other students. And then when reasonable accommodations are being made, once they get to a facility, the facility says it's too challenging, and then they either fail the student or they drop the student, and then the faculty are scrambling and say, well, we don't have anywhere else for them to go. They have to wait. Or because everything went virtual, they use platforms that weren't accessible and weren't willing to use dual platforms in order to make things accessible. Those are the realities, right? So people who get accommodations in the didactic or classroom settings for extra time in that, all of a sudden, miraculously, they're supposed to not need extra time in the clinic. Really? you know, the accommodations that happen in field work don't match what happened in the classroom. From everything from recruitment to the technical standards are written about how someone should do it, not what they need to do. So instead of saying must be able to communicate effectively, they say speak in English, hear, talk on the phone, and things like that. They don't, manipulate, and things which are, in the US illegal. In other countries, not necessarily illegal, but not inclusive. In other countries, also illegal, depending on the province or country. So, but in the world of OT, why is this even an issue? We are the task analysis experts. We are the function experts, but yet we don't see individuals with disabilities and recognize their identity. People with disabilities also get other illnesses and injuries that they may be coming to therapy for, but their identity and their life experience and exposure to things and how they do things may not have anything to do with this current diagnosis that they're there for therapy for, but it's totally disregarded, or they don't get services because they say, well, they were already disabled. So like someone is incomplete quadriplegic and loses function because of an accident, doesn't get therapy because they say, well, they've already been paralyzed for this many years, but they've had a change in functional status. That happens, so many times because we don't view disability as identity. And then in the intersectionality of things, we don't look at how other race, ethnicity, religion, communities, life experiences impact how they view disability themselves. And now we have an ADA generation. So how someone from in my age, that's not an ADA generation, that was a fighting for the ADA generation, didn't grow up with rights, right? So we were used to the fight. Whereas now you have individuals who most of you on here, I'm looking at are very young, grew up with rights. So you have expectations. And then when you expect those things to happen and they don't in college, because in K through 12, everything's done. People are doing for you. People are taking extra steps to ensure that you can do things, but they haven't taught you how to advocate for yourself. So there's this entitlement opportunity too, where individuals with disabilities don't have the ownership of understanding that they do have an identity and that they do have rights and that they can express what they want, what they need, and have a responsibility to do that. You don't have to accept no, or you're doing it the wrong way because you don't do it the way I do it as a walking non-disabled person, so with no cognitive or processing issues or mental health or anxiety or whatever, the disability might be. So what I see is the move, and what's needed is, one, we have to change in our academic settings that we're not just talking about disability in the medical model. We need to speak from it as a social context. We need to teach and have individuals with disabilities teach from the disability perspective, from disability identity, because it starts with education first. Surveys were done on DEI and that went out to all the academic programs and students. And they all thought, oh yeah, the programs do great with talking about disability. But what they were talking about was diagnosis and treatment of people with disabilities. None of it had anything to do about equity and inclusion of peers and becoming professionals and being the leaders. There is nothing there. There's no data on it. There's nothing in our profession. So one, we have to capture the data, not just the data on who gets in a reasonable accommodation to sit for MBCOT exam. That's the only data we have on disability. We don't allow people to identify as a person with disability. We stifle students with disabilities from expressing their experiences, just like we do people from different race and ethnicities. When you're the only one in your program, you're not supposed to speak about your experiences. You're supposed to accommodate to the environment. You're supposed to view from the lens of the colonial lens of the white woman in our profession, mostly wealthy women who walk. So we say WWW and we add an extra WWW to it as an acronym. And we don't allow people to really put forth that experience and that richness that a person with a disability or from any marginalized community, or and not always marginalized, but just minority, not the majority of your program or of that class or that particular day or whatever. We don't acknowledge that and allow people to share that and to embrace it and to respect it. And so I think that's where the biggest issues lie. We need standards to be changed because a lot of the standards that are there are still disability diagnosis, the medical model situated. We need, whether that's through ACOTAD or even in university policies, we need to be doing self-evaluations and transition plans to eliminate policies that are discriminatory. We need to have processes in place with disability services with all health professions so that they're not just dealing with the classroom setting, but also with field work and residencies. We need to check our biases on disability, and that we're still, I don't know how many therapists, OTs, and PTs have done everything in their power to slap long leg braces on with me and try to get me to walk, and only to blow my shoulders out, because that makes me look less disabled. Personally, I think it makes me look more disabled because I'm less functional. So how can we start making those changes? And that's where we start. We have to identify our biases. We have to recognize disability identity as an identity and all the intersectionality that comes with it. We have to evaluate and change our policies and procedures. We have to put systems in place, and we have to start partnering with disability organizations and disability experts that already exist within our profession and elevate them to the level of leadership, and not that pain in the ass that's always saying we're not accessible. Because that's what we hear, and it costs too much, and understand that being accessible and inclusive is the cost of doing business. And it's what we profess as a profession to do. So if we're going to be true to our own profession, then we need to be true to our colleagues and our students with disabilities. Soapbox. So.
Yes, yes. Well, thank you very much. That was very informative. And I think it definitely speaks to the theme of igniting. Really, all three of our panelists tonight really gave us a lot to think about. Are there any questions before we move to breakout sessions in just a minute? Questions or comments?
I would just challenge everybody to start to be a part of the international campaign. Diversity includes disability. Disability is diversity.
Yes.
Stephanie, I don't know how to raise my hand on here.
Oh, please just jump in. Yes.
I truly, like Sandy said, I truly believe that it starts in the classroom, because, some people, like you said, some people, once they get past 12th grade and don't know how to advocate for themselves, they figure it out real quick. But a lot of that learning happens in your cohort, in that classroom setting, especially with OT school. You normalize that disability and you form that respect. I know when I started OT school, a lot of people were like, hey, how are you going to do this? And I'm like, I don't know yet. We'll figure it out. But you create that mutual respect. And I think that would make a huge difference if you bring in faculty that have disabilities as well, that, you're kind of paving the way for a student that doesn't know how they're going to do it yet, but knows that they have the skills to So I think that original cohort is where everybody, including the ones without disabilities, you form that respect and the learning.
Yes, absolutely. Representation absolutely matters, but also the physical accessibility to enable it to do it. If you don't have an accessible website, if you always portray people with disabilities as the patient, if you, like for me, I had to go in the back door, up the loading dock, past the asbestos dump, the high voltage wires and diesel fuel tank in order to get in the building. And if I wanted to close the door and use the restroom, I had to go a block away. You know, how many people with physical disabilities want to come to that environment? If there's no Braille signage, if you don't have alternate format, if you're using platforms that aren't accessible to someone who's blind, why would they come? So some of it is taking that reflection and saying, where are we? And it's and understanding what are our bias, where are we physically, policy wise, et cetera, so that how do we eliminate the barriers? And then what do we have that we can put in place so that if someone shows up for an interview, you're not interviewing that student in the cafeteria or that applicant in the cafeteria when everyone else is getting a tour of the facilities. Because I can tell you from doing trainings all over this country for OT programs, there are so many OT programs I can't even get in without having to go through the back door and some maze in order to even get there. So what are we doing in our own environments and communities to make them inclusive?
Really important point, I think, all of that. And thank you also, Caroline, for sharing. That is really important. It is the attitudes, but it is the physical accessibility as well. It's all of it. And we need to advocate for that as faculty, as OT practitioners, and not just leave the onus of that to be on the prospective students or the current students.
And it's like Tal said in the comments, the biggest barrier we have is attitude, because if you have the right attitude, everything else can be fixed.
Yes, yes. And that's kind of like Caroline said too. If, if the student goes in and has the attitude, and the faculty does too, is we don't know how to do everything. We can't always do it proactively or preemptively, but we can commit early on to figure it out and to fix it. Okay, well, we are to the point where we need to move into breakout rooms. So what we're going to do tonight, I'm going to ask one person at least from each group to take some notes so that we can debrief verbally. And I want to hear from every group when we come back, what something big that came out of your discussion is. So I'd like for you to all talk about anything that stood out to each of you from the panel discussion. And then what have you seen or experienced that relates to inclusion of OT practitioners with disabilities? And really, we want to focus on something that each of us can do individually to help to improve inclusion and equity for OT practitioners with disabilities. So we don't have a Google Doc for tonight. Let's just do it by taking notes, and then we'll share, and I'll take notes when we come back. We are going to have 25 minutes for this discussion, and then we will come back to the big room for, well, let's do 20 minutes, and then we'll come back to the big room. So I'm going to open the rooms. You will see an invitation come, and we will come back in 20 minutes. Here we go.
I love seeing more faces. Hello. Selena.
Yeah. All right, welcome back, everybody. Got people slowly but surely coming back in. All right, welcome back,
Oh, I see
everybody.
so many familiar faces and returning
Yes.
Ignite crew.
It is so great. So let's do a little bit of debriefing. Let's talk about what your big takeaway or aha moment or action step was in your small group. Who wants to go first? Who wants to break the ice? Let's hear from somebody in group 1. Breakout room 1. What did y'all talk about, or what was something that went on in your room?
Hi, sorry. Trying to pull up my notes. So we talked about frustration with barriers and environment within the profession and how that was very noticeable. And the lack of knowledge and how occupational therapy as a profession appears to want to limit disability identity and not recognizing that there's the attitude versus the physical accessibility, and we talked about how they're equally important. And one of the gals in the group talked about how older universities seem to get away with not having to make the areas more physically accessible because they're older.
Yeah, the buildings or the campus is older, and sometimes there's some loopholes there. That's for sure true. Thank you, Jill. I appreciate that. So anybody from group 2 want to share about something from your group, please? You guys are being shy. All right, I won't call out the groups. Let's just open the floor. Who else wants to share a takeaway or an idea for an action step?
I can speak for my group. We were group 7.
Okay, let's hear it.
So one takeaway, which it was like a great use of OT school vocabulary, was the fact that we're not taking into account like the ideas and the experiences of people with disabilities into our OT school like curriculum and stuff. We're actually losing a potential, like there's like a huge loss of therapeutic use of self, right? Like we're not really exposing ourselves, and then in exposing ourselves to those experiences, we're not like learning to be better at working with people, right? So that's something we discussed. And then one action we talked about was making it a requirement for curriculums to be more inclusive, including using a more inclusive education style and then more inclusive objectives, in terms of like, providing closed captioning during like all presentations and stuff like that rather than after the fact.
Yeah, that's really important. It really is. I appreciate that. Okay, who else? A takeaway, an action step, anything you want to share?
I can share. Oh, did I cut
You
someone
can
off?
go, Kelsey. It's okay.
Oh, you say it. It was your saying. Go for it.
No, it's all right. You can do it. It's
Okay, well, I'm gonna quote. So something we said was that we're constantly reflecting on others' selves instead of ourselves. So this needs to be reversed, and we can start looking at our own biases and attitudes in order to see change within the profession. That's kind of like a takeaway and an action step mixed in one.
And I would like to add to Kelsey that we need to be more flexible as OTs. We always talk about how flexible we are in the profession, but we're not really flexible with our assumptions when we deal with others. So this flexibility would really affect on our daily practices and would change our specific attitudes with the population as well.
Very good point. Flexibility of mind and our attitudes and our biases that we all have. Okay, anybody else?
Hi, my name is Deja, she, hers. I had a small group discussion with one other person, and something that we talked about was as students who become future fieldwork educators, for those of us that go that route, just kind of like looking into the language in which we deem a student's success. So something that stuck out to me was criteria of passing, like what is passing, what is the language, and diving into that as a fieldwork educator working with other professionals in that sense.
Thank you, Deja. I appreciate that. Yeah, and I think, you know, there are set criterias. There's that fieldwork form that the fieldwork educators fill out, but some of that stuff is subjective, and a lot of it is able to be adapted. So again, I think like Sandy mentioned, if someone has a disability that prevents them from transferring a patient, they can tell someone else how to transfer. And, you know, there are other ways to accommodate that in many cases aren't that big of a deal to do. So again, kind of that flexibility of mind or being adaptable with that. Okay, I think we have time for one more. Anybody else dying to share?
I think one important thing that came up in our group was the fear of saying something because of reprisal. And so having resources available to individuals so that they don't, you know, because you can advocate for yourself only so much because you got to graduate. So having that, you know, there needs to be at a national, state, and institutional levels that, just like there is for race and ethnicity, there needs to be those resources that support disabled students and faculty and employees in the same manner, so that the EEO kind of equal opportunity kind of things don't get down to get down to where it gets into a litigious environment, you know. And so so trying to figure out better procedures for that in order for people to be able to voice their concerns and get the accommodations they need without reprisal.
Yes, for certain, there's a power dynamic that it just exists there, that, you know, when there's the faculty member or the fieldwork educator or the academic fieldwork coordinator, there is that power dynamic over a student, especially when they have scoring or grading responsibilities with that person. And it's something we at least need to acknowledge and have an awareness around. Thank you. Okay, well,
one thing, Stephanie, sorry, I was also Sandy's group. Another thing that I think we need to also talk about, or at least begin to acknowledge, is that not all of us can work at the level that we are expected to work. So I would love to be an OT faculty member and be that representative person, but I cannot work at the pace that my able-bodied colleagues work at. And the expectation is that I do that and twice as much. And so, you know, in disability studies, we talk about crib time, we talk about pacing, we talk about flexibility, and that is not existent within occupational therapy. Although we talk about energy conservation, and again, all of that lovely therapeutic client stuff, but you know, we have to accept that if we want to see more of us in those positions, we have to have part-time opportunities, and we have to have opportunities for people to work at their pace, and to not devalue that and to not then say, well, you're not as good as the other people on the faculty because you can't work the 18 hours a day that we think you should be able to work in order to be who you are. And that's not a conversation I have heard many of my peers actually want to have with me and other people.
Thank you, Susan. Excellent points. Lots of things to think about. Well, thank you all. I hope those.
I was just going to mention one more thing.
Okay.
That also don't expect colleagues with disabilities that they're always going to come and present for your students or talk about their experience for free when you're paying other guest speakers, you know, for the good of your peeps. You're just showing that you don't value their colleagues equally. And when you look at salaries and stuff, make sure you're equitable because, you know, when we started polling people and comparing them to colleagues, employees with disabilities are being paid significantly less than those without, even if they are doing the same hours and same responsibilities and sometimes more.
Absolutely. I mean, that, you know, speaks to that equity for sure. Well, I want to tell you all a few things that we've got in the wings that are coming up. And this is really hot off the press information. It's the first platform that we're releasing the information on. But many of you may be aware that last year, well, we typically have an annual breakfast that's in conjunction with AOTA conference in the spring, and we have it on the Saturday of AOTA conference. And last year, because of COVID, everything going virtual, we switched and made our annual event virtual, and we called it COTAD Live. And we are now presenting the second annual COTAD Live session on Saturday, April 24th in the morning, 9 a.m. to noon Central Time. We have a very exciting keynote address that is going to be done by Dr. Jaime Munoz. In the title of it is Justice-Based Occupational Therapy, Reaching Critical Mass. Registration for this event will open Saturday afternoon, this weekend. So there will be more information and registration, ticket purchase will be on the COTAD.org website, and it'll be all on our social media as well. In conjunction with our annual event, we give out awards, and we have several that have been given yearly. That is the COTAD Chapter of the Year Award, the COTAD Mentor of the Year, and so that's through our COTAD chapters. And then the COTAD Educator of the Year Award, which is through our COTAD Ed division. New this year is a new Practitioner Impact Award. And there is information about each of these, how to nominate, how to or what each criteria is for that, and how to submit that nomination on our website. Now, I want to invite someone else who is on the COTAD board who is here this evening to speak about a project that she is heavily involved with, and her name is Whitney Harris. Whitney, would you speak, please, about the service project?
Sure thing. Thank you, Stephanie. Hi, everybody. So yes, I'm a board member as well, and I also am on the team for COTAD Community. And this year, this will be the second annual service project. So we did one last year. So if you were involved with that, thank you. We do have another one this year. And again, since we're still virtual, our volunteer opportunity will be virtual again. And so we have actually 2 ways you can participate this year. You can participate by donating to the Amazon wish list. So this will be supporting Breonna Taylor's high school, Western High School. So we actually collaborated with the high school and created a list of items that they're needing, and it ranges from hygiene items, but also like, you know, school supplies, highlighters, notebooks, etc. So you can donate there. or you can donate to COTAD and help us, or support us with our current and our future service projects. But by doing either one of these, again, this is either one you can do, you can also enter to win a free COTAD shirt by posting on your social media. So, on your Instagram, Facebook, we'll keep track of that, and we'll enter everyone in for a raffle, and then we'll pick 3 names. And we will actually share that with everybody at the COTAD live event of who won. So we have that. If you have any questions, you can email us, actually. Let me put that in the chat.
Yeah, and definitely keep an eye on our Instagram, because a lot of this information is going to be coming out on that.
Yes. So there will be, more detailed information about this for sure. And then, and then we have a book club, which is also what I'm a part of. COTAD Book Plus Club discussion is this Saturday, March 13th, 11 a.m. Central Time. We will be discussing Rising Phoenix, which is a documentary on Netflix. It's a really, really amazing documentary about the Paralympics. And there's a few participants that share their stories in that documentary. And we will actually be having 2 special guests, which isn't really on the flyer, but we actually have 2 special guests. It'll be an instructor from Washington University in St. Louis, who is also has been a Paralympics coach. She's going to share her experiences with us, and she's also an occupational therapist. And then we also have one of her players that will be joining us. So Jeff Butler, sorry, excuse my charged my head, not my heart. But there's a player that will be joining us as well, who was on the wheelchair team. So and he would actually participate in the Paralympics as well. So it'll be really great discussion. So please join us for that. And as you can see, you can get more information and register at cotad.org, or check out the social medias as well.
And registration for that event, the Book Plus Club meeting, is free. It is at cotad.org, and it is open through 24 hours prior to the event.
Yes. So
all right. Yes. So I wanted to share, thank you for sharing that, Whitney. I wanted to share some resources that we have kind of collected over this Ignite series, and ask if anyone knows of other resources that you can recommend or are involved with. You are welcome to put those in the chat. We would like to share that with other people in this event. And to close out by saying, please follow COTAD on social media. We encourage each of you to join COTAD. There is a membership option on our website, and to stay involved and up to date with what all we've got going on by following us on any of these social media platforms. And with that, I would like to conclude this event and this series. Thank you so much to our panelists. We really appreciate your taking time to share your experiences, perspectives, and expertise. And thank you to all the attendees, not just for this session, but for all the Ignite sessions. So this is our 13th session that we have had of all the Ignite series. And we've had some people that have been to all of them, some people that have been to some of them. And for some people, this may be the first that they have attended, but we many of those are recorded and available on our YouTube channel, as this will be within the next week. And we just appreciate everybody showing up, and hope that you are action oriented and ignited, and let's continue the momentum. Thank you and good evening.
Thank you.
Now I can't seem to get a smile out of my head. All that tall, dark, and handsome African man. This morning I caught myself wondering if he was too tall for my bed. Oh, now you got me talking on the phone. Oh, now you've got me writing new songs. What the hell's going on? I'm doing way too much. That's how I know I'm in good trouble with you.
All right, I think it's just our core crew. Thank you, panelists.